Good afternoon, everyone, and welcome to the Multicultural Media Online Conference hosted by the Ministry of Health, the New South Wales Multicultural Health Communications Service with Multicultural New South Wales. Thank you very much for joining us today. It's always a pleasure to see you all with us. I am your moderator, Jesusa Helaratne, Deputy Director of the New South Wales Multicultural Health Communications Service, and I'm pleased to be back after being away for a few weeks. And I would like to thank Dr. Marianne Gale, who kindly hosted the last session. Today is World Menopause Day, which aims to raise awareness about menopause and show support to anyone who's going through the menopausal journey. Most women will experience symptoms of menopause, and many women will experience early symptoms while still having periods. And this year, World Menopause Day theme is cardiovascular disease, highlighting how crucial it is for every woman entering menopause to be aware of cardiovascular risks associated with it. And that's why we're putting a focus on women's health and also on menopause. And we're pleased to have joining us today as our special guests. We have Dr. Joanne Fizzell, Senior Medical Advisor for New South Wales Health, and from the Office of the Chief Health Officer, who's a regular speaker, as you all know who she is, for these sessions. Good to have you back with us, Dr. Jan.
Good to be back. Thanks, Jess.
It's a pleasure to have you. We also have Dr. Clare Wong, obstetrician, gynecologist, and advanced laparoscopic surgeon and lecturer of Western Sydney University. Thank you very much, Dr. Clare, for taking time to be with us today.
Thank you, Jessie, for inviting me. Glad to be here.
Thank you. And we've got a lot of questions for you, Dr. Clare, so I'm looking forward to the answers. And also joining us is Joanne Pertz. She is a women's health nurse practitioner and co-chair of the Menopause Taskforce at the Agency for Clinical Innovation. Joanne, it's a pleasure to have you joining us for this special topic.
Well, thanks for inviting me on World Menopause Day. Lots of hot flushes here.
Lots of hot flushes. Yes. Thank you so much for being with us today. But before we begin, would like to acknowledge the traditional owners of the land from which we're all meeting from today. I am joining you from the land of the Darug people. We pay our respects to elders, past, present, and extend respect to Aboriginal elders and colleagues. And we also acknowledge the elders and leaders from all multicultural groups represented at this session today. I would like to ask for you joining us online to please add your name to the chat and let us know what organization you represent and where you're joining from today. We'll do our best to answer all your questions. And as always, we'd like to request if you can please keep your microphones on mute. And as we'd love you to ask your questions on the chat, share your thoughts with us during the session. And Dr. Clare, Dr. Jan, and Joanne will answer your questions and try to do their best to answer your questions. And my colleagues from the Multicultural Health Communication Service will also be adding links in the chat for resources and information available in multiple languages and health initiatives that you can download from New South Wales Health, the MHCS, and New South Wales government websites. So we'll start with the questions today. Dr. Jan, 50% of New South Wales population is women, and girls and women's health and well-being are important area and focus. Can you tell us about your thoughts on how we can continue to promote women's health? Because it's an important matter to everyone, for families.
Look, I think this is a really important topic because there are some things that affect women or people who are born female that don't affect blokes who are born male. And these are really important things that can happen during pregnancy, such as hyperemesis gravidarum, which is really severe nausea and vomiting in pregnancy, menopause, so the changes that we go through life, and then the experience of breastfeeding, which can be a really great bonding experience, but can also make people feel uncomfortable and uncertain, and making sure that people know that there's a lot of help and resources to cope with these three really important aspects of women's health and helping people understand where to go. And a really good starting point, of course, is your GP, but also there are lots of other resources online, but also the messages that we can share with each other as women, as partners of women, as brothers and fathers of women, things that we can do to help support women through their life journey as they go through different changes at different points of life.
Thanks so much, Dr. Jan. Joanne, today is World Menopause Day, and you did say lots of hot flushes. So let's start with menopause. What is menopause exactly?
Thank you for that. So menopause occurs when someone hasn't had a period for 12 months. And most women reach menopause between the ages of 45 and 55, though some will go through earlier than that, and some women at a later stage as well. The lead up to menopause is called the perimenopause, and there's lots of changes that go on with symptoms. So it's mainly about our hormones and how they change. And there are many changes during this period of time, and a lot of our women don't really understand what's going on for them. So symptoms like hot flushes, suddenly feeling very hot, sweating at night, getting up to go to the toilet, trouble sleeping, and changes in mood. Every woman is different, and symptoms experience can vary, and sometimes that's when it's really difficult to diagnose it, because women are not sure what's going on.
Thank you so much,
Yep.
Joanne, for that. Dr. Clare, it's really nice to have you with us, and being from multicultural backgrounds, and the session today, it is something that we some people may not be comfortable talking about. Sorry, Clare, Dr. Clare, you're on mute.
Yes, I do agree with you. Because different ethnic group, the perception is slightly different, and most of the women depends what kind of symptom they experience. What I noticed, because I'm from a Chinese background, I do have a certain proportion Chinese patients, and they don't want to speak about that. And the other obstacle for them, because they have some very funny perception about hormone. They look at hormones like complete like very a dangerous drugs. So therefore, they don't speak about that. And when they come to see you, they usually have suffering from quite severe symptoms. So I do agree with you, and the patient might not want to speak about that. They usually might would like to see their own doctors speak their own language. They might find that easy to communicate, and only when they're in that situation, they will speak about that in more openly.
Thank you, Dr. Clare. And Joe, just going back to
Yeah.
what you mentioned, there is the World Menopause Day, and that the government has launched a new menopause campaign. And there's still some stigma around menopause, and with multicultural communities and most communities around menopause, and people may find it difficult to talk about, and that's why they're talking about it today, to raise awareness. Are there resources that people can access to help understand menopause and symptoms?
Yes, absolutely. So that resource could be your GP or your other allied health professional, and you can get support if you're experiencing difficult symptoms related to menopause or the perimenopause. For World Menopause Day, the New South Wales government has launched a new menopause awareness campaign. So part of this campaign is the perimenopause and menopause toolkit, which is free online toolkit, includes a menopause symptom checklist. So something that you could take to your GP or to a women's health centre or nurse practitioner to review. And podcast series are being developed as well to look at the symptoms of both menopause and perimenopause. To support diverse communities, and I agree with Dr. Clare, often women want to sort of get that information in their own language. I have noticed, though, that the Khmer language and other emerging communities haven't really been included yet with some translations, and that probably would be a good thing. Menopause symptoms checklist has been translated into 8 languages. This is a helpful tool to start a conversation with your doctor about the symptoms that you might be experiencing and what treatments might be available. A new resource is also for partners and family members of those experiencing perimenopause, and menopause has also been developed and shared with via the toolkit, so families can better understand what their loved ones are going through and support them. Because I think from my experience, it's been really difficult for families, partners, children to know what's actually going on as well. Thank you.
Thanks so much, Joe. And I think I'd like to request for everyone online to please ask your questions. And we do have Sonam asking a question: is there any treatment to delay menopause or even treat it? Can you get pregnant during menopause? Sorry if this strikes you as a dumb question. No, Sonam, nothing. No question is dumb. Thank you so much for your question. I'll go to Dr. Clare and Joe and Dr. Jan.
So Jessie, can you repeat the first questions?
So Sonam is asking that is there any cases in terms of is there any treatment to delay menopause or even treat it?
Unfortunately, there's no delay. Menopause is a natural process, and menopause means that at some stage your ovary stop functioning, so therefore you reach menopause. But however, symptoms caused by menopause, and we can use hormone replacement therapy. So there's treatment out there to help you to ease your symptoms.
Thank you so much. Joe and Dr. Jan, would you like to add to that?
There was a question about contraception as well.
Yeah.
What was that question?
Could you get pregnant during menopause?
Yes, you could. And I do a lot of contraception in my role as a women's health nurse practitioner. And we usually advise women to continue with contraception until their 55th year. It may be reviewed earlier than that, but certainly there is still a risk for pregnancy in that sort of perimenopause and early menopause timeframe.
Well,
yeah, I don't think it's unheard of, Jess, for somebody to think that they've entered menopause only to have a baby in their arms a few weeks later.
Absolutely.
Thank you very much. And there are some more questions. Thank you so much for asking the questions. What is the age range for perimenopause?
So the range of perimenopause from 45 to 55.
Thank you. A question from Damien McCall from the Center for Population Health. We're doing some work on raising sensitive issues, particularly for GPs. What's the panel's sense of GPs' comfort in talking about menopause and the change of life, as my mother used to call it? So, Dr. Jan?
Look, I think it's something that GPs are very well aware of, but it's one of those things that sometimes the GP may wait for a woman to actually raise it with them in the context of a women's conversation, or do I really need another prescription for the pill, or is it time to get rid of my current contraception? And they may not actually bring it up. And because a lot of women may actually not know that the fact that they're kicking their blankets off in the middle of the night or coming out in a drenching sweat, sometimes they're actually very, very scared about what's happening because they know somebody else who's had drenching sweats and has had, something really awful going on. So I think it's that need to raise these issues, with people sensitively and kindly. And Joe's probably got some good hints for doctors who might be listening with us.
Well, thank you for that. I think it's about being sensitive, and I know that in many of my consultations, I would raise and actually name that the symptoms that she's experiencing are probably related to that perimenopause phase. I often find that women, when they get decent education, and we use a lot of interpreters at the workplace that I'm at, that they really start to understand what the process is and what menopause is all about, and understand what treatment options are available. From experience, some women do find that some of their health practitioners are reluctant to look at prescribing hormone replacement therapy. And I think with all of the evidence that we've got now, it's a real shame if someone wants HRT and is suitable, that they're not able to be given it. So there's a lot of a push with the Australian Menopause Society and others to, really educate GPs and other health professionals about menopause and management.
Thank you so much for that. Yes, so I think it's really good questions. Thank you so much for those questions. And I wanted to ask Dr. Jan, in relation to COVID, is there evidence that women experiencing menopause and perimenopause be more likely to experience serious complications from COVID?
I don't believe so. I think the thing is, though, some of the symptoms of having COVID, like having a high temperature and so on, can be confused with going into menopause or vice versa. So it just, it's one of those things that if your body's changing and you're not feeling well, talk to someone about it. That's the most important thing, because there's more than one reason why these things can happen to us. It's quite easy sometimes to either try and brush something off as not very important and not seek help when we need it. And also, it's also quite easy sometimes to put something down to COVID, or have I got long COVID? And in fact, it's menopause. That's one of the reasons why when people recover from COVID and they're still not feeling quite right, we do tell them, go and talk to your doctor, because it's not like the COVID's brought on the menopause. It's just the fact that, you know, if you're a certain age, things can coincide, and it's a good idea that if you're not feeling well, to go and actually talk to someone who can help you.
Thank you so much, Dr. Jan. And now, Dr. Clare, we are discussing another women's health issue today, which may not be well understood, which is hyperemesis gravidarum. Oh my God, please let me, how do you pronounce that?
It's hyperemesis gravidarum.
Hyperemesis gravidarum, or HD. Can you tell us?
Lots of vomiting in pregnancy, Jess. That's how it translates.
Well, tell us more about it. It's a condition for pregnancy, as I understand.
Yes, it's a condition which occurs in pregnancy, and it affects about 1 in 100 pregnant women. So I think all of you might already have heard about morning sickness. It's quite common. It's now we call that nauseous vomiting in pregnancy. So I'm sure all the women, most of the women experience mild symptoms, mild to moderate symptoms in the early pregnancy, but they still are able to eat and drink. But hyperemesis is more a severe form of the nauseous and vomiting, and it lasts for days and make it very hard for the woman to eat and drink or keep anything down. And this can lead to dehydration, weight loss, and vitamin deficiency. So therefore, we encourage women to talk to the GP, talk to their obstetrician and the midwife if they are experiencing this difficulty in eating and drinking because nauseous and vomiting. And it's also very important to talk to the doctor, because we need to perform a certain investigations to exclude other conditions that might also cause nauseous and vomiting.
Well, it sounds like a very difficult condition. How can pregnant women tell if they have HD, and what support is there for women with HD?
Okay. If you suspect you have hyperemesis, and especially your nauseous vomiting is very interrupting to your ability to eat and drink, so it means that you can't keep anything down, you keep throwing it up. So you should speak to your GP, your midwife and obstetrician, and they can assess the severity of your symptoms, and they will discuss with you the management options. And hyperemesis is not always well recognized, and so therefore don't be afraid to ask questions and seek help. If you don't tell your doctor, and they will not know. So hyperemesis is quite debilitating medical condition. So therefore it's important women who experience this condition and are listened to and will get the treatment they need. So there's actually lots of help out there available to ease the symptoms. If you have mild or moderate nauseous vomiting, and your doctor usually will recommend changing your activity, get more rest, eating small but frequent meals, and seeking more fluids, avoid dehydration, and avoid taking vitamins that may contain iron, because iron makes you more nauseous. You can taking gingers, it will be helpful, and anti-sickness medications. There's quite a few anti-sickness medication out there to help you as well. Taking vitamin B6, and sometimes might need intravenous fluid.
Thank you so much, Dr. Clare. And there are other things as well to be wary of, right?
So if you have severe form, then you are dehydrated, and the doctor usually recommend you have admission to the hospital, because in the hospital we will start you on intravenous fluids and correct your dehydration, and we will give you regular anti-sickness medication and to help you ease your symptoms. So there are many other type of treatment, but this is all based depending on your need. So New South Wales Health has more information online about hyperemesis, which you can read and understand a bit more about this condition.
Thank you so much, Dr. Clare. And Dr. Jan, what support services are there for women experiencing hyperemesis?
Look, as somebody who actually suffered from this quite spectacularly with my pregnancy with my son, it's really something that getting good help really can make a big difference too. And I know a lot of women, because often it's occurring quite early in pregnancy, are concerned about the medicines. But Mother's Safe is an excellent resource for you. They can talk to you about things that you can do to help stay safe with your pregnancy and your baby. And they can also work with you through an interpreter. So if you call the telephone interpreter service and ask them to put you through to Mother's Safe, they'll be able to help you talk to Mother's Safe about things that you can do, both medical and non-medical, to help with these symptoms. But the really important thing is that if you are that unwell, you're not alone. There is help available to you, and help is really available to you. So please make sure that you do reach out for help, because suffering through that is something awful.
Thank you so much, Dr. Jan. And Joanne, you may have had experience with this, through your work.
I have actually. I'm also a midwife, but I haven't practiced as a midwife for quite a while. But I do see antenatal patients prior to them going to hospital and provide advice. I don't see a lot of HG, but certainly when I do, it's women are quite distressed by the fact that they've got to spend some time in hospital with maybe some medication in hospital away from their families. And if we're looking multiculturally, making sure that the good translations are available with telephone interpreter or face-to-face, so that women really understand what's happening to them. Good nutrition, getting the sleep, as Jan has already said. Yeah.
Thank you, Joanne. And our final topic that we're talking about today, we've talked about menopause, pregnancy, as well as HT, and also we want to talk about breastfeeding. We've spoken about breastfeeding before in this forum and know that it's not always easy. What are some of the things people should know about breastfeeding, Dr. Jan?
Look, we all know that one of the great things about breastfeeding is that it's, free and readily available, which is a fantastic start. It's really helpful to your baby. It's got fantastic, antibodies, all sorts of things that can really help your baby get off to a really great start in life. And it's a complete food. It's a human food for your baby for the first 6 months. But what people don't sort of get is that it can be really hard work. And so you have to have time and you need support to establish that breastfeeding. Some babies are fantastic. They just latch on and go for it. Others actually really do take work between mum and bub to find the right positions, the right ways to, what works for that baby. How do I stop my baby from gobbling too much? The really important thing, though, is there's no right or particularly wrong way of doing things. It's about practice between you and your small person and getting help. That's the really important thing, is that if you're having any trouble getting help, and there's so much help available. And it's really also important that people around you are supportive of you, because it's very easy for people to see you getting distressed, because I don't know about other people, but when I was a new mum and trying to get my breastfeeding relationship established with my baby, I can still remember the day that I'm just like, no, I just can't do this anymore. And just having that encouragement around me to say, look, it'll be okay. We'll just get through this next 5 minutes, get through this next hour, get through these next 6 hours, made a huge difference. And I was still breastfeeding my son for some spectacular length of time later. Let's not go into that. But basically, it can take quite a long time to get that thing right, up to 6 weeks. It's not like it's a overnight thing, but it takes the village around you to be supportive of you, and it takes patience and kindness to yourself while you're doing it.
Thank you, Dr. Jan. And there are available resources in languages for everyone. And Dr. Jan, there's a question that is asking, can you feed your baby when breastfeed when you have COVID?
So yes, you can. It's about being safe and careful. It's about wearing a mask and about spending probably less time in the room than you would like to, and making sure that you're both well. But at the same time, it's about being kind to yourselves as well. So if you're really unwell and really not up to it, maybe you pump and get somebody else to help feed bub while you're doing this. you're not going to pass on the disease through your breast milk. And in fact, you know, if you start generating antibodies, you may even do that. But I think we had some guidelines up about how to work with your baby and to keep your breastfeeding going through COVID. But again, be kind to yourself is one of the key things with that one.
Thank you, Dr. Jan. And Dr. Clare, what are some ways that partners and families can help a breastfeeding mom?
Wow, there are many, many ways. And we do know the support and encouragement from their partner and family members so important to breastfeeding, especially your mom, mother-in-law, and auntie, sisters. So there's many things, and you can help, and especially when a breastfeeding woman, they're pretty tired, getting up multiple times at night. So as a partner, if you can take up, do the housework and let the woman have more sleep during the day, that will be very helpful. And there's also lots of breastfeeding education out there, especially in the antenatal clinic, in the hospital. We have GP actually specialized in, have interest in this area, and they actually specialize in breastfeeding and can be provide a lot of a good consulting with the patient. And there's a breastfeeding consultant in the antenatal clinic. They run regular courses, so you can attend those classes with your partner, and that will be very, very helpful as well. And even simply letting your partner know you're going to support them through the breastfeeding journey, I think that's one of the most important thing you can do, and will be and that's what she needs as well. So, and also, lots of things we can go around to help your partner, because like feeding is only one part of being a parent. So you can help your partner doing bathing the baby, changing nappies, setting the baby to sleep, and playing with the baby. And this is not only a great way to help your partner, but also and get to know your newborn baby.
Thank you so much for that, Dr. Clare. And I have a question that's come up from Sonam as well, again, is in terms of touching on how menopause can impact the partners of women going through it. And I think it is about how families can support whether you're going through menopause or breastfeeding or going through some issues for women. Joe, I'd like to ask you about this in terms of how a partner can support someone who's going through menopause and how it could impact the family.
Well, I think communication is the key. It's just so important in a relationship or whatever the arrangement is to communicate with each other about what might be happening. So if someone's having some mood swings or not sleeping well because they're getting up at night to go to the toilet, then they might not be in the greatest mood the next day. So just talking and saying, look, this is where I'm at with this. Even around if you're talking about sex and sexuality, there's so many changes to the vagina. The vagina becomes drier. Women's libido drops down. So there might be, issues around, actual sex. We talk a lot about, regaining relationships, because lots of things are happening at midlife. We might be stuck in a sandwich where with our elderly parents and or young children, there might be relationship issues that are going on. So it's a whole conversation that we would have around, healthy relationships and, just talking and debriefing about what might be going on. But there are fact sheets from the Jean Hales Foundation, which is a really good resource, and there are translated fact sheets there that do provide some assistance around talking about some of these, intimate issues, or, looking at what the symptoms are and reassuring women and partners or people and partners that, this is what's happening and this is a normal thing that happens in a woman's life.
And it does happen, as we discussed earlier, that people don't want to talk about it, but and that's why we're raising this this topic. Dr. Clare, in terms of that from community, so what would you like to say, especially for the multicultural media, in how this could be shared, this information can be shared to communities?
I would say In terms of sharing the information, we will provide a forum to more like similar forum like this to the community, and especially if you could conduct the forum in their language, that would be helpful. And we need to have more information, written information like pamphlet, and disseminate to the community, and also raise the awareness. Because in terms of the menopause symptom affecting the partner, I do have some information I want to share, because especially in the Asian population, women tend not to talk about this. And also menopause symptom, not just hot flushes and night sweat, and sometimes can be mood swing. And this mood swing, the partner will find the patient all of a sudden change to different person, but they don't understand this is because the menopause kicked in. And the poor woman, because they don't talk about that, and they keep holding on, and the symptom becomes somatized. So they become feeling uncomfortable everywhere, but they don't understand it's menopause caused the mental issue as well. So I think that raise awareness, use different a tool like from forum to written pamphlet in their own language, that would be great help for the community.
Well, thank you so much, Dr. Clare. It has been a very important session today, quite informative, and thank you everyone for your questions. And Dr. Jan, as always, there is a phone line for communities to contact, isn't it, for mental health?
Absolutely. So it's important that if people are having any mental health problems, that they do reach out to that multicultural health mental health service, so that they can get additional support if needed. Because I know that some of these changes are not just physical, but they can also impact us quite significantly. So definitely to reach into that transcultural mental health line.
Well, thank you so much, everyone, for joining us today. Dr. Jan, Dr. Clare, and Joanne, thank you so much for being with us today. Are there any last words that you'd like to share to the multicultural media and to the health workers and community that have joined us today? I'll start with Dr. Clare.
Thank you for inviting. I found it very useful. I learned a lot from you guys as well. And hopefully I can contribute more in the future.
Thank you, Dr. Clare. And Joanne?
Oh, thank you for inviting me. I really enjoyed it. And again, too, I learned something new as well. Thank you very much.
And Dr. Jan?
Look, I think it's really important that people understand that just because something's natural doesn't make it necessarily pleasant or easy. So reach in for help. There's lots of help there. There's lots of help in your language that's available to you. And the telephone interpreter service is also there to connect you through to those different services that you might need.
Thank you so much. We will see you all again next time for our online media conference. To our speakers, thank you for joining us. The recording of this session will be available on the Multicultural Health Communication Service website. We'll also share this online and also send out an email with all the resources available. We want to be able to feature important health topics such as today of World Menopause Day that are important for our communities. And so we'd like to ask you to tell us what you want to be featured so that we can invite medical experts to answer your questions just like today and provide all the relevant information to keep our loved ones and our communities safe. I would like to thank the teams from the Multicultural Health Communication Service, the Ministry of Health and Multicultural New South Wales for working together to provide information and resources in multiple languages available for everyone. And for World Menopause Day, we'd also want to acknowledge New South Wales women for their work on the resources that's available this week. So thank you again for joining us. I'm Jesusa Helaratne, your moderator, and thanking you, and hope you take care and stay safe.